Hey guys, Don here. Welcome to the $1 Million Minute, where I'm going to go over the things that have kind of worked in our practice to get it to the $1 million mark and beyond. Today, I missed a day. I didn't really miss a day. It's because I had surgery on the previous day, so I'll go over that a little bit. So surgery was a sesamoidectomy, a tibial sesamoidectomy. There was a bunionectomy, Austin bunionectomy, and then a derotational arthroplasty of the fifth digit. And then the third patient had a soft corn between the toes, and we did a derotational arthroplasty because the head of the proximal phalanx was hitting on the skin there. So a couple of ways I tried to optimize the surgery is those surgeries I did the pre-surgical shockwave. So at the recent conference they talked about pre-surgical shockwave. There's really no consensus of how many sessions you need. I did three may have been overkill, may have been underkill, not really sure. I'll tell you and show how it's healing, if it's healing any faster or things like that, as we go with those surgical patients. Where I do surgery is at a hospital where there's residents, so a hospital, a lot slower. For those three cases, I got out of there about 2 p.m. So hence one of the other reasons it's not as much fun. I like teaching residents, so that's the fun part. But the kind of wasting my day away is kind of the reason I don't do as much surgery, and I prefer being in the office. So it kind of confirmed that. But that's just my take. I know many people have other takes on that, but I think if you work in we have a surgery center as well, but the block time that I have is at this hospital, not at the surgical center. A couple of other interesting things that happened during the day is I met with IKS. So IKS, they recently purchased Acuity Scribing Service. So that's the service that I use. And I was talking to the rep because I'm kind of interested in doing some talks for them. I really like my scribe, and I think scribing really helps to produce a lot of revenue, and a lot of people have a hard time adopting it, and especially people think that AI is going to replace it. It might replace it over time, but I think right now, everything that Morali does for me can't really be done by a person. They can make an okay note, but he's able to send orders, do x-ray reads, just do a lot of other stuff where I don't even have to really open up the chart unless I'm signing the notes. So I was talking to him about that, maybe at a conference or something like that. I think it would be kind of a fun side gig, and also I'm really passionate about it. And I know I've recommended a few people to that company. So everyone always asks me what it is. It changed names. It's IKS or Acuity. And so if you're interested in learning more on Podiatry Practice Mastery, there is some Scribe resources on the bottom if you're interested in considering. What's the main reason, in my opinion? Well, I went and reviewed my numbers. I was at about, I think it increased my revenue about $200,000 from not having a scribe to having a scribe. I probably work a little bit more hours to make it worth it. So it comes directly out of my pocket, my scribe does. So I have to actually earn $100,000 more in production to pay that $30,000 cost. Now, if all the doctors used it, it would come out of our overhead. But since I'm the only one that uses it, it comes directly. So that's a steep amount. So, but you have to think of, in my opinion, I think he reminds me of a lot of the stuff. I think I'm producing more, billing more. My notes are better. And more importantly, I think I'm getting home sooner, and I'm less stressed because he's taking care of the details of the notes. So I think there's a lot of other intangibles for that $30,000 for my scribe. The other thing that happened during the day is we met with Kira Medics. They came in in the morning time, and so the issue is we have 2 radial machines, one in each office, and then we have a focused and we have a softwave. So the softwave was given to us, not given, but lent to us. It's called a puppy dog close. It's where you let someone use something and see if they like it. And we've had it. Now, we have put about, I think it's 160,000 shocks. So let's say it was 150,000 shocks. So 1,500, 1,500. So we've done it on about 100 patients. At this time for that. And the problem is the handpiece in the softwave wears out about 2,500. I'm sorry, 250,000. It kind of stops, and you have to send it for refurbishing, which is a couple thousand. Also, the problem with the softwave, we're kind of talking, I'm just kind of letting you know my thinking process here. The other problem is softwave is more expensive than focused. So softwave, I think if you only had one machine, and you wanted to have softwave, I think that makes sense. It's about $80,000. We have radial, and we're using focus. So focus is a little bit less. I think they quoted us maybe $55,000 or $60,000. And it has like bone, you can penetrate into the bone and things like that. So we're thinking about, okay, do we buy this one or do we give it back and get another focused? I think we're looking towards giving it back and getting a focus, because we wouldn't have got the softwave unless it was kind of thrown at us. You know what I'm saying? So we've been testing it out. So I'm just letting you know my thought process behind this. I think if you only had one machine, maybe softwave would be great. Try them out. I think give the test. And now they're wanting us to do EMTT. We are currently not doing it. I know a lot of people love it. I'm like, so the difference in the practice is like I'm the one that would buy everything and spend money on everything. And that's why it's good to be balanced with some of the other doctors where they're like, skeptical and they don't want to try the EMTT. They think it's like voodoo. So I'm just letting you know, I'd like them to drop it off and let me try it on the patients and see if they kind of get better faster. Okay, let's go into the day. First patient was an 80-year-old female. She's here for a 6-week orthotic follow-up. She's also here for follow-up on her flexor tenotomies. So she did flexor tenotomies 3, 4, and 5. Orthotics are doing fine. And now I'm sending her back. She actually came here from a faraway city. Not far away, but like probably 45 minutes. And she was seeing another podiatrist that never offered the flexor tenotomy and never offered the orthotics. So I tend to find when people come as like a second opinion, they're more susceptible, I guess, or more willing to do things. And now I'm going to be sending her back there. Also, another thing that was happening, there was a doctor here recently that he had some hip surgery, and he wasn't able to see his patients. So I did reach out to this other doctor and said, hey, happy to see some of the patients, because his patients are already coming over to see us. It would be more of a routine, but I'm more confident in accepting these routines now because we have our nail tech. Okay. Next patient was a 51-year-old female. She's a new patient. She had, on the right side, she had plantar fasciitis. And on the left side, she had the IPK, and I did lesion destruction, for that possible wart on that region. And then for the plantar fasciitis, I talked about we could do the first types of treatments, or we can just go right to what works. And she's going to do the 6 sessions of Shockwave, so we set her up for that. That would probably be my most valuable patient, and we're going to scan her for orthotics on the 3rd visit. Okay. I'm almost thinking about, like, for these orthotic scanning people, maybe even scanning them the first visit, because it's so quick, and that way I won't forget, because sometimes it's hard to remember, like on the 3rd visit, to scan them. So anyway, that's the thought. Next patient came in. He's a routine care patient, 75-year-old, but he had some ingrown toenails, so I did bilateral, or both sides of the left hallux, a matrixectomy. Next patient was, she was a Swift 4 of 4, and I also did Cantharidin on her, so just because she had some really difficult warts. I'm going to see her back in 3 months and see how she's doing. There was another Swift patient today, kind of frustrating. She was actually here after 4 sessions, and she's here for the 3-month follow-up, and she's still not better. And so I did Cantharidin on her, so this is Swift number 5 with Cantharidin. I'm not sure what you guys are doing if you're using Swift, but I was at like a level of 8. I did 6 zaps in 2 seconds each in all the locations, and she's still not improving. So she's a little frustrated. I'm a little frustrated. I'm hoping to still give it time. I was considering even maybe doing laser or adding laser on top of the Cantharidin, but I'm just kind of throwing everything at her. That was a different patient. But these have been warts that have been there for like years. Okay. Next patient was a 71-year-old. This is session 4 out of 6 of Shockwave for plantar fasciitis. Starting to feel better by the 4th one here. Next patient was a 66-year-old patient. This was a new patient. He had some foot pain, possible gout. We did x-rays, and I'm thinking it's more of a gout issue that was for him, so he's going to just come back as needed for that. We just did the office visit. Next patient was a 51-year-old, number 5 out of 6 for Shockwave for plantar fasciitis. Next patient was a 75-year-old patient that came in for orthotics, about 90% better with orthotics. This is an orthotic follow-up, no need for follow-up. Next patient was a new patient that has a really big bunion with an overlapping second toe, so I'm referring them to one of my colleagues here for a lapidus. Next patient was a 61-year-old patient was here as well for an orthotic follow-up. She's having a few knee issues. I think the issue is she didn't break her orthotics in like was recommended. She just wore them all day long, every day, and then her knee hurt, so I told her to kind of break it in slowly. We'll kind of see how she's doing. Next patient was a new patient, and once again, I offered them to do like the nail sample and follow up, but they wanted to do the Lamisil right away, so we did terbinafine. We skipped all the first step with the nail sample. She also has a wart on the right foot, and we did cantharidin on that wart. So I'm going to see this patient back in 1 month for the wart, and then 3 months for the Lamisil follow-up. These ones I did at LFT as well. Next patient was EPAT number 2 out of 3. This was for the plantar medial heel. And the reason I didn't do 6, I think, is because they were kind of hesitant. So I'm going to do 3, see them back in 6 weeks, and I just prefaced that we may need to do a few more sessions. Next patient was a follow-up for Achilles. The Achilles is feeling much better. No need for further treatment. Next patient was 56-year-old female status post matrixectomy, doing better. And we talked about, this is a patient that likes to talk about intermittent fasting with me. There's a new app, HAVA. It's by the diet doctor. So I always like these things. And so it's a new app that you can take pictures of your food and stuff like that. So if you like that, you might like this app, HAVA. Next was a 74-year-old with an ulcer at the tip of the third toe. Recommended a crest pad. And I'm going to see them back in 3 months for routine. I got an x-ray. There was no osteo. Next patient was a 55-year-old. That EPAT number 1 out of 6, and I did an x-ray, did an ultrasound. So this was a new patient, so this is probably another most valuable patient. We talked about orthotics. Actually, he already had orthotics, so we just did the x-ray, ultrasound, and set up the shockwaves. Next was a patient. This is a challenging patient. She's a 30-year-old female that got bit by a barracuda on her foot, and she has a big scar. So I did laser scar treatment for her. And that helped it, but she's still having some neuropathy pain now, and that's the struggle. So we talked about doing an oral gabapentin. We talked about some of the topical things. And I also said I would try Shockwave for her, because I've heard they're on really low levels. That might help bring back or help with the nerves. I'm not sure if she can pay for it or if insurance would cover it, but I'm going to try to get it, because I have some insurance has been covering more Shockwave now. Next patient was an ulcer debridement for an IPJ hallux. The ulcer is getting better. He was scanned for orthotics as well to offload that area. He'd had orthotics years ago. Next patient was a 54-year-old with an ulcer on the third toe. I talked to him about doing a flexor tenotomy, but right now we just did a crest pad and covering on it. He's going to be back for nail care, so I'll reassess it at that time. Next patient was a 39-year-old that she's doing about 90% better. She had pain to the 4th and 5th metatarsals, and we did an MRI for her because she was so paranoid, and everything kind of lit up on the MRI. But the reason it lit up, you have to be careful if you're doing a lot of Shockwave and do MRIs. Everything lights up because of the bone marrow swelling in there after the Shockwave. Okay. Next patient was a 52-year-old, had peroneal pain and posterior tibial pain. She's doing better. I don't need to see her back. Next patient was a nail care patient. She'll come back on our nail care day. And the last one was that Swift that I talked about. So it was kind of a busy day, kind of a challenging with certain patients, especially the ones that kind of stressed me out were, there was one that had pain at the posterior tibial tendon at the insertion and navicular. And I did a couple of sessions of Shockwave, and she was in so much pain, I was concerned about a stress fracture, and I got an MRI. So in hindsight, maybe I should have got a CT instead. But everything lit up, and so that's the problem. Everything lights up after Shockwave, so really be careful. This happened to 2 patients. I don't order a lot of MRIs if I'm doing Shockwave, but I happen to. I think they just requested it, and I did it because they were all concerned. So I think looking back, if I could do it over again, maybe just reassuring them everything's going to be okay, and not doing the Shockwave and just giving it more time. Okay, so those are the things of the day. Hope you guys found this beneficial. Let me know your thoughts. Okay, have a great day.